HHS Idea Lab, creating a modern and effective government by equipping HHS employees and members of the public with methodologies, air cover, and pathways for innovation. 6 pathways for innovation: HHS Innovates, HHS Innovator in Residence, HHS Entrepreneurs, HHS Ignite, HHS Ventures, HHS Competes. HHS Entrepreneurs, pairing internal ideas with external expertise, looking for the best talent in the U.S. 6 all-new projects. We caught up with each internal entrepreneur to learn more about the project. Tell us about the Creating De-Identified Claims Data project.
This project is to select an entrepreneur who can help us work through some very thorny issues around de-identifying sensitive Medicare claims data in order to fulfill and further our goals of open data and increased transparency. We sit on an absolute goldmine of healthcare claims here at the agency, and it applies to many of the most vulnerable segments of our population, namely the elderly and the disabled. However, we're very committed to open data. We've made huge strides in recent years in releasing certain types of data sets publicly, but where we really want to push things is to figure out a way that we can get as many people as possible access to raw claims or something approximating raw claims, provided that we have appropriately de-identified the data first.
What are you looking for in an external entrepreneur applicant?
I think we're definitely looking for somebody with a very strong knowledge of healthcare data and how it works, how it fits together. We're also looking for somebody with strong knowledge of how healthcare data can be de-identified in a way that can still render it analytically useful and easy to use. So, somebody's going to have to know the impact of, taking away age versus geographic location or different things like that. So we're looking for creative, outside-the-box thinkers. Definitely, I think they probably have to have strong statistical skills, because a lot of the issues will involve figuring out if we have statistically de-identified the files in a way that the agency is comfortable with making them more broadly available.
What will an external entrepreneur get out of this experience?
I think the benefits are huge. First of all, while working in the federal government may have its occasional challenges, there really is no other place we can have such a massive impact on the lives of people. I think specific to this project, this person would have the benefit of working with some incredibly smart, dedicated, and talented programmers and data scientists who know Medicare data and Medicare claims data really well. So I definitely think, it wouldn't be a one-way street. The entrepreneur would definitely be bringing their perspective and their skills, but they will probably be learning an awful lot about Medicare data and healthcare data in general as well.
Apply now at hhs.gov/idealab/pathways/HHS-entrepreneurs/